Welcome everyone to the FAFSA webinar, The Trump Budget, How Scientists Can Fight Proposed Cuts to the National Institutes of Health. We're going to go ahead and get started now and try and keep to our 1 hour time limit. The agenda for today's webinar is laid out here. We'll do a brief welcome and introduction to FAFSA for those of you who don't know us. We want to provide real-time information about the President Trump budget request that was released this morning. We'll do a little bit about the process in Congress and what happens next. And then the last portion of the webinar will be devoted to how scientists and citizens can take action to fight these proposed cuts. And we will also have time for questions and answers at the end of the webinar. To ask a question, you simply should click on the orange arrow on the dialog box that you should see on your screen, and then type the question in the white box and hit send. We do have everybody on mute to ensure the sound quality of this call and make sure that there are no disruptions, but please feel free to submit your question at any time. What we will do is hold those questions and answer all of them at the end. And again, we promise we will have time for Q&A. So for those of you who don't know us or are not familiar with FAFSA, we are a federation of 30 different scientific societies, and collectively we represent over 125,000 researchers from pretty much every discipline in the research community. Our mission includes a lot of advocacy, and we work in concert with our member societies, which is also why we're hosting this webinar today. This slide shows the logos of the 30 FAFSA member societies, and some of you participating today may actually be members, in which case we thank you for being a member of a FAFSA society. If you are not and are interested, you can contact us afterwards and we can get you connected with the right group. So this morning at about 11 a.m., the Trump administration released their fiscal year 2018 budget request. This is for the federal fiscal year that actually will begin on October 1, 2017. For those of you who have been paying attention lately, you may remember that, I don't know, maybe 2 weeks ago we talked about the 2017 budget and a big increase that was approved by Congress for NIH. That was because the 2017 budget was about 7 months late getting completed by Congress. So we are having a lot of budget activity in Washington right now. The proposal that was released by the administration this morning has a couple of overarching broad goals. One of them is to balance the budget over a period of about 10 years and to reduce the current debt load that we have as a percentage of gross domestic product to what will be the lowest level since 2010. Getting to that first theme requires some cutting. So what the administration has proposed to do is to actually increase the budget for the Department of Defense and for Homeland Security by cutting almost all other areas of what's called non-defense spending, and that includes things like biomedical research. For those who have been involved in budget advocacy for a number of years, you might also remember the word sequestration and how that was an issue in 2013. Since then, Congress has actually eliminated the sequestration cuts by doing other things, but they come back again in 2018, including for the Department of Defense. And the budget released by the administration proposes to eliminate that cut for the Department of Defense. The budget also talks about targeted investments in highest national priorities, which under this budget are border security and immigration enforcement, infrastructure, and reforming welfare. So as a result of the overarching themes in the administration's budget, we did see a number of dramatic cuts, especially for the federal science agencies. There are 5 that are priorities for FAFSA, and that's what we'll be talking about on this webinar. The first, and the agency that would sustain the biggest cut under this proposal, is NIH. The administration is requesting $26.92 billion for NIH. This is about $7.16 billion, or 21% below the 2017 budget that was just approved. Things do not look good either for the National Science Foundation, which would sustain about an 11% cut. The Department of Energy Office of Science is proposed for a 17% cut, and even agricultural research would sustain a roughly 7% cut under the president's budget. And the VA medical research program for veterans takes about a 5% cut. One thing we wanted to note is the numbers in this table are actually compared to the final 2017 budget that was passed about 3 weeks ago. If you go online to the White House website and look at the documents there, you will see a discrepancy in the numbers. That is because the administration is using the fiscal year 2017 level that was active under the continuing resolution that actually expired at the end of April. So there is a little bit of a discrepancy. We are choosing to use the 2017 final budget as the comparable figure to present, I think, a more direct display of what this proposal would do. There were some additional details specific to the National Institutes of Health in the President's budget that was released this morning. The first is that it proposed the total elimination of one of the institutes and centers, the Fogarty International Center. It did, however, provide a $25 million pile of money for international research that would be put into the Office of the Director at NIH to continue some of the operations that are previously handled or currently handled by Fogarty. In addition, it proposed transferring the Agency for Healthcare Research and Quality, that's underneath the broader Department of Health and Human Services umbrella, to NIH and renaming it as the National Institute for Research on Safety and Quality. Included in there was about $272 million to carry on some of the activities and functions that AHRQ currently does. It also included the full amount of funding specified for the 21st Century Cures Act. That was legislation passed by Congress last year and would provide $496 million for the projects authorized by 21st Century Cures. Also deep within the documents is a new proposal to institute what's called a uniform cap on indirect costs. This is a particular interest for universities. The cap would be at 10% for all NIH grants across the board. So the President's budget, when it's introduced, is really only the first step in what is honestly a multi-stage, multi-month process. It usually takes a minimum of 6 months to get a budget through Congress, and as we've seen more recently, it can take a year, up to a year and a half. So this table here, or this chart slide here, shows the typical budget and appropriations process schedule. That's the text in red that's now been stricken out, and we've overlaid kind of where things are. What you'll see is we are already months behind the typical process. This is not unusual. All new administrations typically submit a budget request late. May is fairly late. So the President's proposal was submitted this morning. The congressional committees will now go through a long process of reviewing the budget from top to bottom. They will be having hearings with cabinet officials and the heads of agencies. This process actually started earlier this week. We expect there to be probably 100 hearings between now and the next couple of months. The committees have also really been collecting information and testimony and input from stakeholder groups like FAFSA. And the committees that have the primary responsibility for doing all this work are the House and Senate Appropriations Committees. FAFSA has already submitted testimony on behalf of NIH and NSF and the Department of Energy and USDA with our funding request for fiscal year 2018. The next step in the process is one that may actually get skipped this year. Typically what would happen is the House and Senate budget committees reach some kind of an agreement called a budget resolution that gives them an overall spending figure and some broad themes or targets. We don't know if that's going to take place this year because we're already so far behind schedule. But what we do anticipate happening next month is that the appropriations committees in the House and Senate will receive what's called a 302 allocation, or that is the overall amount of money that they have to spend on all agencies and programs and services. That 302A allocation will then be subdivided among the 12 appropriations subcommittees, and that's when you will really see the rubber meet the road in deciding how much funding goes to each specific program and agency like NIH or NSF. For now, there is an existing law in place called the Budget Control Act that specifies the absolute funding cap for 2018. Technically, the Trump administration budget proposal does meet that cap, but because they're proposing such huge cuts on the non-defense side to increase funding for defense, it is in technical violation of what the current budget law envisions. So we are at this point anticipating that the appropriations committees will simply use the existing budget cap in law as their total overall spending figure. Also in June, we think we will see the appropriations committees do the hard work of actually drafting the 12 individual spending bills that make up the total federal budget. Each of these individual spending bills must be passed by the relevant subcommittee, then by the full appropriations committee in both the House and Senate, and be put on the House and Senate floor for a final vote by all members of the House and all members of the Senate. A very lengthy process. We don't know how far along things are going to get this year, because again, they are so far behind schedule. But since we know that they're going to get started, we are really trying to get our activism going right now, especially since these cuts that have been proposed by the president are very concerning. No matter what happens over the next couple of months, the federal fiscal year absolutely begins on October 1, 2018. So we think things are going to be quite busy this summer. In terms of why we wanted to hold this webinar and why we're asking the scientific community to get involved, again, it really is Congress who has the final say on what the federal budget looks like. So just because the president has proposed cuts doesn't mean that these automatically become law or will even be law at some point. We have seen in the last couple of years very strong bipartisan support in Congress for NIH and NSF and the other research agencies. In March of this year, 206 House members signed a letter to the Appropriations Committee actually asking for another $2 billion increase for NIH in fiscal year 2018. So very different from what was proposed today by the president. We also saw over 160 House members sign a letter in March again to the Appropriations Committee asking for a $600 million increase for NSF in 2018. So already members of Congress are thinking about increasing funding for these agencies, not decreasing it. We do know that many members of Congress may not be fully aware of how much federal research funding benefits their states and districts. And my colleague Ben is going to talk to you a little bit about where you can get information to answer that question. And then last but not least, we are really seeing that voters are having a greater impact on members of Congress and what's happening, and they're expecting to hear more from their constituents. So we are hoping that you will join us on a big campaign over the next couple of months to make sure that these cuts never happen. And then last but not least, for my part of this presentation, wanted to share with you some data about why we think advocacy really makes a difference. There's been some survey work done by an organization called the Congressional Management Foundation that works very closely with members of Congress and advocacy groups like FAFSA. And their data shows that right now, and this is a little bit old, but 88% of congressional staff said that emails have some or a lot of influence on their bosses. We're seeing very high levels of engagement and impact with social media, especially when multiple posts come from their constituents. An interesting fact or survey piece of data that came in more recently said that 45% of congressional staff said that as few as 30 comments about a specific issue on social media were enough to gain the attention of the member of Congress. And about half said that social media makes members of Congress more accountable to constituents. So we, again, later on, we'll talk a little bit about how you can use social media to help fight these cuts and raise awareness about them. I'm now going to turn this over to my colleague, Ben Krinsky.
Great, thank you, Jennifer. So with that in mind, we just want to talk a little bit about specifically what you can do in your advocacy efforts. And first, just to give an overview here as to the goals of our current advocacy efforts. It's really, I think you can sort of conceive of our advocacy efforts at the moment as really having a short-term and a longer-term component. In the short term, obviously, we're holding this webinar because the administration just released its FY18 budget proposal. So really, in the short term, we really want to get everyone, as many people as possible, to tell your elected officials that these cuts to or proposed cuts to biological and biomedical research would indeed be deeply damaging to our nation's health, economy, standing in the world, etc. And as Jennifer alluded to, there are many members of Congress in both parties who would like to see increases to the science budget. So we indeed would like to encourage all members of Congress to support robust increases to the scientific agency budgets as opposed to the proposed cuts. Of course, in the longer term, really what can make advocacy effective is really a matter of developing personal relationships. So one of the things we'd like to facilitate is for all of you to develop working relationships with your elected officials and to help them to understand the importance of biomedical science. It's really, you as constituents really have an enormous amount of influence over your elected officials, and if you get to know them and they get to know you, that can really just make that relationship so much stronger and much more effective. So practically speaking, how do you take action? Well, There are a couple things you can do that require less of an investment of time and effort. For example, sending an email or making a phone call to your member of Congress. Of course, as I was just saying, we'd like, if at all possible, for you to go further, to meet your representatives and senators, particularly when they're back home, and I'll say a little bit more about that in a moment. And of course, we also encourage you to use social media to connect with your elected officials, and really the ultimate goal here is, in a much broader sense, is to educate and inform the public. That is to say, your members of Congress, but of course the broader electorate, about why science, in particular biomedical science, is so important. So what do we have available for you? So we have a lot of information and a lot of tips and tricks and other useful things on our website. The link is listed at the top of this slide. And really, this is really designed to be a toolkit for you, to make you a more effective advocate so that you can bring the message to your elected officials as to the importance of biomedical research. So one particularly useful tool on our website is under the Become an Advocate link. This is under our, if you go to our website and go to Science Policy and Advocacy, excuse me, and go down to our Legislative Action Center, you'll see a window that opens up that looks like this. And on the right-hand side, where you can see that red arrow is pointing, is actually a tool that allows you to look up the contact information for your elected officials just by entering your zip code. Sometimes the website requires you to add your street address as well. That's just because of the nature of the shape of congressional districts is often strange, and sometimes they overlap multiple zip codes, or one zip code, excuse me, has multiple congressional districts in it. In any case, after you put in your information and search, the output looks a lot like this. This is just an example. Representative Tom Cole happens to be the chair of the Appropriations Subcommittee that oversees the NIH budget. And as you can see on this page, not only does it give the contact information for your members of Congress here in Washington, but also the contact information for their local offices in your home states and districts, as well as phone numbers for those offices. In addition, it lists the members of Congress's website, as well as any social media or other contact information available. And if you actually scroll down on one of these profiles, there's a whole lot of information about your elected representative. So this is really a wonderful way to learn more about them, and also to find ways to actually get in touch with them directly. So one thing I mentioned a few moments ago is we really encourage you to try and meet your elected officials locally, or meet staff in your local offices. So as I said, our website has this tool which allows you to find where your local where their local offices are. I should say that those offices are staffed at all times, not just when members of Congress are back home. So you can actually set up meetings with staff in local offices at any time. And we encourage you not only to reach out to staff in those offices, but you can ask them about when the members of Congress will be home and when they'll be making public appearances. For example, when they might be holding town meetings, office hours, constituent coffees, things of that nature. And just for your information, at the bottom of this slide, we've listed 3 upcoming extended congressional recesses. So these are times when it is extremely likely that your members of Congress will actually be back home in their home states and districts. First is the Memorial Day recess, which will be May 29th to June 2nd. Then they come back to Washington for a month or so. They then go back to their home districts for the July 4th recess. That's July 3rd through the 7th. And then they have an extended summer recess from August 1st through September 4th. So there really is a lot of, should be a lot of opportunities in the coming months for you to actually reach out to your members of Congress when they are local, when they're back in their home states and districts. So as I said, our website has a lot of information about how you can set up these meetings. We try to make it as painless as possible. We have information here under our advocacy toolkit about how to request a meeting. This site even includes a sample email, so all you have to do is sort of fill in your own personal information. You can use the text as written here to request a meeting. We also have a whole slew of so-called best practices for holding a meeting. So for those of you who haven't been to a meeting with a member of Congress before, or haven't met with their staff before, we have a whole list of sort of best practices, do's and don'ts for what you want to do in one of those meetings. Just to be a little bit more explicit about that, this is really not meant to be intimidating. I know there's a lot of text on this slide, but the bottom line is that when you meet the staff member in a congressional office, it really is supposed to be a cordial conversation. After all, you are a constituent. Your member of Congress is supposed to be representing your interests in the government, and so it really is not something that's supposed to be intimidating, but something that's supposed to be exciting and an opportunity for you to make your voice heard. So, in general, these bits of advice are pretty intuitive. First, before you attend your meeting, be prepared. Particularly, it's good to know what you're in, as we say in Washington, what is your ask? What specifically would you like for your member of Congress to do? So in this case, in light of the budget situation, we want our members of Congress to support increases for the science agencies, increases in their budgets, and to reject the cuts that have been proposed by the administration. A second point is it's important to do your homework. So you can, of course, as I mentioned, we have a way where you can go directly to your member of Congress's website. You can learn more about them, their positions on various issues. You can see how they vote at congress.gov, and you can also go to their social media sites to learn more about their general stance on various issues. When you go to your meeting, we provide a lot of materials on our website. I'll talk a little bit more about those in a moment, but you can bring all kinds of information to them, including our state and district fact sheets, our federal funding report, and our newsletters. And one thing we always emphasize with regard to these meetings, it's important to stay in touch. So after you've had your meeting, it's important to follow up, thanking the member of Congress or the staffer, and briefly summarize what you talked about, and of course repeat your ask. And again, we're trying to help you to sort of cultivate relationships with these congressional offices. So keep in touch with your legislator through occasional correspondence or visits down the road. And of course, if a staffer asks you for some specific piece of information or asks you to follow up in some very specific way, make sure to be a good citizen, to follow through on your commitments and give them whatever information they ask for. So as I said, we provide a wealth of information on our website. As many of you who have done advocacy with FAFSA before, as many of you know, every year we generate these state and district fact sheets. These are available on our website. We have data on federal funding for research for all 50 states, as well as most of the congressional districts, the House districts across the nation. You can find them, again, here on our website under Science Policy and Advocacy. Under Federal Funding Data, there's a link to our state and district fact sheets, and it'll generate a map, and you can just click on your state, and then once you've clicked on your state, you'll see a list of districts for the House of Representatives, as well as statewide data, and you just click and immediately download a PDF that you can print out or use in electronic as an electronic version. Every year we also generate our federal funding report. This is the set of recommendations FAFSA makes every year for the agency budgets that support biomedical and biological research. The latest edition is available here. There's again a link under federal funding data for our annual federal funding report. This document again is available for download for free in PDF form, and we also have you'll see at the bottom here it says view the brochure. We also have a condensed version which specifically highlights the budget numbers that FAFSA is recommending for this fiscal year. And again, we are emphasizing the importance of increasing the budgets of these agencies. We want a predictable, robust, sustained increase in these agencies, not cuts. Last but certainly not least, in terms of our efforts to provide educational materials, we have these two wonderful newsletters, the Breakthroughs in Bioscience and the Horizons in Bioscience series. For those of you who are not familiar with it, Breakthroughs in Bioscience are these newsletters that describe cutting-edge areas of scientific research. They are sort of like short magazine articles pitched at a very broad audience about the importance of biomedical research. The Horizons series is a bit shorter, and they are targeted towards sort of emerging or cutting-edge areas of science that may be particularly of interest to policymakers. So all of the issues again are available for download on our website under this link called Resources for the Public. And in a recent development, we also have converted the breakthroughs, several of the breakthroughs articles into podcast formats. You can actually listen to them on your favorite electronic device. So another dimension to your advocacy efforts that we've had some great success with recently, and we really encourage you to do, is to invite your elected officials to visit your laboratory. This is really a wonderful way, again, to develop those personal relationships and allow your members of Congress to see firsthand the important research that is happening in their district and why these federal dollars from the research agencies are so crucial to activities going on right there at home. As I said, this helps to build those personal relationships, and when your legislators go back to Washington, they can bring these stories with them. In other words, it helps members of Congress, it helps them to be better advocates in Washington for biomedical research. So it is really a great thing to do. Suggest a lab visit anytime you meet with a member of Congress or a staffer. Say it would be wonderful if a member came to the lab. Love to show them around. Love to tell them what it is that you're doing.
And that applies to staff as well. If you have trouble scheduling a time with your members of Congress, every single one of them has local aides, and it's definitely appropriate to invite the local aide to come visit your lab. And oftentimes that might be a little bit easier to set up because they don't have as busy a schedule.
Thanks. Thank you, Jennifer. So other ways you can reach out, we of course encourage everyone to connect on social media. Our Twitter handle is here. We have a whole bunch of sample tweets. These are particularly themed around the most recent budget proposal. These are ways you can, again, urge your members of Congress to work together to increase the budgets for agencies like NIH and NSF and oppose the cuts. Another campaign we've been undertaking recently is for you to write and submit letters or op-eds to your local newspapers. Again, this is something that can be done. This can be done at any time, but particularly news outlets like to publish op-eds that are particularly timely. So if you want to make your voice heard about why cuts to the science agencies would be so damaging, why we have to be increasing our investment in science, this is a great way to do so. Again, on our website, under the link Get the Word Out, this is again under our advocacy link, we have a whole toolkit about how you can write your letter, how to submit your letter, and a whole set of best practices about, again, how to get the word out in the media about why biomedical research is so important.
And when submitting a letter or op-ed, one of the best things you can do is go online to your local paper and find out what their policies are for submission. Many have very strict word limits these days, and if you submit something that exceeds that, it could be automatically rejected. So take a few minutes to look at the policies of your local newspaper.
Okie doke. Again, we want you to stay engaged in as many ways as possible. So in addition to what we've already mentioned, we encourage you to go to our website. You can sign up to receive our FAFSA e-action alerts. These are periodic emails that go out if there's something particularly timely happening in Congress, for example, a key vote. This is a way that you can be informed of that, and this is a way in which we encourage all of you to get involved, to, again, contact your members of Congress to push them to support biomedical research. We would also encourage you to subscribe to our bi-weekly Washington Update newsletter. This is a newsletter where we provide updates not only about what's happening in Congress and on the legislative side of things, but also about science policy more generally that affects biological and biomedical science. And of course, please follow us on Facebook. We have an active Facebook page, and again, it's another way in which we provide information to all of you to be better advocates.
All right, thank you, Ben. We've gone through quite a bit of information here, and so we want to turn the webinar over to the rest of you to get questions and answers going. So again, just a quick reminder, we're going to have to ask you to just type your question and submit it electronically so that we can minimize disruption and noise. So we will start going through the question. We're going to try and get to every single question, but I did want to make folks understand that we are recording this webinar. So we will provide an archived copy of this on the FAFSA website in about 3 or 4 days. And if you have additional questions after the webinar that you would like to submit, we will also try and get those in there as well too. So why don't we go ahead now and start with a number of the questions that have come in. And again, please continue to send your questions in. We want this webinar to go until about 3 o'clock. So we've got about 30 minutes right now. So why don't we go ahead and start with the first question. It seems unlikely that Congress will pass a budget and appropriations bills before they leave for the summer recess. What happens if Congress doesn't pass a budget or appropriations bills before October 2017? Will we see another continuing resolution, and is this a better or worse outcome for NIH? This is a multi-part question which we are happy to tackle. So right now, yes, that is a correct observation. Given how far behind Congress is in working on the 2018 budget and the amount of time it takes to write and pass all these bills, it seems unlikely that Congress is going to get much done, which is actually a good thing for us because that will allow us as an advocacy community to reach out to our members of Congress over the August break when members will be home for 5 weeks to really talk to them about our concerns about the budget and about why we believe that funding for research should be increased and not decreased. That being said, if Congress does not pass the budget or any of the appropriations bills before October, the most likely outcome is what we will see something called a continuing resolution, which is actually what the federal agencies operated under until early May of this year. That means that they will essentially keep the lights on and keep programs running, but at the 2017 budget level, and most agencies will not be able to start any new programs like issue new NIH grants. So we do believe that come this fall there will be a continuing resolution. We don't know how long that will last. To be honest, a continuing resolution might actually not be the worst outcome for NIH, because at least it would hold funding at the 2017 level instead of enacting cuts. But as most people in the research community know who've lived under these continuing resolutions for the last probably decade, they themselves are very damaging when research funding decisions are delayed. So we do want to try and push Congress to continue working on these appropriations bills. Another question that came in, Ben, why don't you take this one?
Sure. This questioner asks, a lot of research institutions are in states, districts whose representatives are already supportive of an increase in biomedical research funding, so any email or phone call is not very effective. How can we reach out to representatives outside of our state and district? Well, this is a great question, and we get this actually very often when we're escorting people like you around Capitol Hill. They say we visit a lot of offices, particularly in blue states, so-called blue states, where they're very supportive of science. Sort of why are we doing this? Well, first of all, it's really important, even in cases, I would say, this maybe goes to the premise of the question, it actually is very important to talk to your members of Congress, even if they have been supportive of research in the past, or even if they see themselves as champions of biomedical research. And that's important for a few reasons. The first is that it's simply, again, it's a matter of cultivating this personal relationship. So even if they are, for example, nominally supportive, we really want to cultivate champions, people who are going to make that extra effort to be advocates for biomedical research. Another one is simply a matter of providing them with a reminder of why biomedical research is important. After all, members of Congress have to juggle hundreds, perhaps thousands of policy and political issues all the time. And again, it's really a matter of reminding them and keeping biomedical research in the forefront of their thinking, such that when it comes down, really when sort of it comes down to the wire and it's time to draft an appropriations bill or pass an appropriations bill, they really have agencies like the NIH squarely in their mind. As it pertains to getting in touch with people, it's outside of where you live. It is actually very difficult to reach out to members of Congress for which you are not a constituent. And again, that's just sort of the nature of the way our federalist democracy works. I realize that it might be tempting. There might be particular members of Congress you have in mind who you want to reach out to who don't seem particularly supportive of science. And again, as FAFSA said, what we try to do is reach out among all the members of our societies to people across the country so that we can get in touch with as many congressional offices as possible.
And one thing you can do if you're in one of these states where your member of Congress is supportive, after you've sent a note saying you're concerned about the budget, take a look at your own contacts list and see who you might know, whether it's a friend or a family member, a former graduate student, maybe someone you mentored if you're a senior investigator. Figure out where those folks live and work, and consider sending them a personal email from your account, or picking up the phone and calling them and say, I live in Massachusetts and my senators are really on board for NIH funding, but I know that you live in Oklahoma or Texas, where we're not so sure where the member of Congress stands, or where the member of Congress hasn't said very much, yet there's a lot of federal dollars going to these states. So consider doing what we call the friends and family approach, reaching out to those that you know, or posting a note on your own Twitter account if you tweet, specifically asking your followers in some of these states to take action and look at the FAFSA resources and contact their members of Congress. So even if you don't have a direct connection to, let's say, a senator from Texas, think about who you know who might. Another question that came in is, this one is from an individual who is a state employee, who has some restrictions on what he or she can do in terms of using or advocating for biomedical research, and wanted some tips for when is a good time to use your professional affiliation and how do you kind of walk that line. So that's actually a really common question we get too. First and foremost, I would encourage everyone to familiarize yourself with your institution's policies. If you work for a university or a research institution, if you're not sure whether or not you have any policies, you can certainly ask your direct supervisor or reach out to your Office of Federal Affairs or Federal Relations, and they can help you kind of walk through that line. If you're not sure who to contact or they haven't gotten back to you, I would say use some caution. We do encourage you to be careful not to use any university resources, whether it's an email address or a computer or a telephone or a tablet to do your advocacy work. We would encourage you to do that either after hours or when you're on your lunch break, and certainly using your own personal computer or your own cell phone, that kind of thing. You can also look to find out when your members of Congress will be home and perhaps doing a town hall meeting or a constituent coffee on the weekend that doesn't interfere with your work hours. And then when you contact the member of Congress, if there are specific restrictions that you have about not using your professional affiliation, then you can write as a private citizen. You know, John Smith from Fort Worth, Texas. I'm writing because I care very much about the NIH budget. So it is a good idea to use some caution if you're not sure what policies are. And you can also use a Gmail address or a personal email address to send your note to your member of Congress. One tip that we would encourage you to do is if you use a Gmail address or a Yahoo or personal email address, please also include your full snail mail address, including your zip code, so that the person who is reading that email message or that letter in the congressional office knows that you're an actual constituent, because we are seeing more and more members of Congress really cracking down on mail that's not from their constituents. Ben.
Okay, one of you asks, in terms of meeting members of Congress, does it have to be a personal visit or can it be over distance such as Skype? This is a really good question. We've actually, I don't know that we've formally asked anyone to do meetings via Skype or FaceTime or any of the new communications technologies. I would say that in Washington, things are, one might say, a little bit old school. People tend to have either personal meetings or phone calls. I would say try it. Reach out to your congressional offices, either via phone or email. And if you get a positive response, but for one or another reason can't travel to your local office or Washington, suggest it. I think more and more people are using teleconferencing services to conduct their business, and so you may get an enthusiastic staffer. They also tend to be on the younger end of things and more technologically savvy, and so I would definitely encourage you to try to set up a meeting via Skype if that's something the office is amenable to.
Yeah, and you can always reach out to the aides and just ask that question if the member of Congress would be willing to have the Skype conversation. We've gotten an interesting question here about why the cuts were proposed to almost all areas of non-defense spending. That is not a question that we have a direct and definitive answer for. The president made it quite clear on the campaign trail and in the budget, the draft budget that he put out in March, that increasing funding for the Department of Defense and for our security agencies was a top priority. The only way to make this budget work and still add up to the overall spending cap that exists in current law that I mentioned earlier was to cut the non-defense side of the budget. So the president is actually not asking to spend any more money than is allowed outside of the cap. What he is asking for, however, is a redistribution of the funds to plus up funding for defense, and the only way to do that and not go above the cap was to cut the non-defense side. Also because while the president did request some cuts in the entitlement or mandatory programs, those were smaller than the cuts on the non-defense side.
Right. One of you asks which committees in the House and Senate handle the NIH and the NSF. So this actually is a very good question, and it actually sort of gets into the weeds of the way in which congressional committees are organized. So in fact, there are separate committees that handle so-called authorizations, that is to say, that set policy for the various agencies of the federal government, and then there's a separate group in Congress that actually handles what's called appropriations, that is how much money is spent. So for the purposes of today's, I think I'll just focus on appropriations. So the way appropriations work is that in both the House and the Senate there is an overarching called Committee on Appropriations, and they're the ones who are ultimately who write the budget bills that set the funding levels for all the agencies. And within each of those committees are a set of subcommittees that handle specific agencies and areas of federal funding. So There's one subcommittee of the Appropriations Committee called Labor, Health, and Human Services. That's a subcommittee that actually handles the entire Health and Human Services agency budget, and of course NIH is within HHS. So that's one subcommittee that handles the NIH budget. Now there's a separate subcommittee that actually handles the NSF budget. That's called Commerce, Justice, Science, and Related Agencies. So that actually handles the budgets for a whole separate portfolio of agencies, including the National Science Foundation, but also the Department of Commerce, the Department of Justice, NASA, and a whole lot of things. There are lots of sort of arcane historical reasons why the subcommittees are broken up the way they are, but things that are sort of generally sort of thematically related, for example, health, tend to fall under the same appropriations subcommittee. So when you're reaching out to members of Congress, and this is a good tip, if you want to know what kind of influence they have over the budget, one thing to do is to see if they're anywhere on the overall appropriations committee, because they would have some sway in the way the budget bills are written. And then in particular, see if they also belong to one of these subcommittees that oversees either the NIH budget. So you can go to the Appropriations Committee websites, click on each subcommittee, and see which members belong to those subcommittees. In other words, see who is overseeing directly the budget of the National Institutes of Health and the budget of the National Science Foundation.
We're getting a couple of questions on the issue of indirect costs, so I think we should probably address some of those. This one is, a cap on indirects of 10%, how can you keep the lights on at a university, let alone other costs of research like human resource requirements and equipment? Does FAFSA have a plan to help us address this particular issue? This actually was something that we got rumors about and were leaked a couple of weeks ago, and we have been working with our friends at the American Association of Universities and the Association of Public and Land-Grant Universities, the big groups that represent, the institutions and the universities in a grand scale. And they have been working very hard to reach out to members of Congress to help inform members of Congress what exactly are indirect costs. It's one of those things that kind of sounds silly, maybe, at the outset, or it's something where you're not even sure what you're talking about. So one thing that you can do is, if you work at a university and you understand what indirect costs are, that is certainly something to talk to your members of Congress and or their staff about. Help explain what exactly is an indirect cost, and more importantly, what happens if they're capped or universities can't recover these. Explain how they impact the overall research enterprise. It's a sort of inside the weeds topic here in Washington that has gotten new attention because of this budget proposal. But what we've been advised, and what I know in talking with some of my own meetings, is if you explain what these are, you can really help change people's minds.
All right. One of you asks, if NIH gets an increase, does that make it harder to raise the budget for other science agencies like the National Science Foundation or the Department of Energy? This is a really great question, and it actually, again, goes to the somewhat complicated ways in which congressional committees are organized and the way the whole budget process is organized. So the short answer is that the individual science agencies, at least the ones mentioned, the NIH, NSF, and DOE, are actually not competing directly with one another for a finite pool of money. And let me explain that a little bit. A few moments ago, I mentioned that the Appropriations Committee in the House and the Senate is broken up into smaller subcommittees that oversee a subset of the federal budget. So the way in which the budget process works is that there is an overall level of spending that is decided at the highest levels, and then each of the appropriations subcommittees is given a so-called 302B allocation. Now, you don't have to worry about what that number means. It's legalese. But essentially, each subcommittee is given a pot of money with which they then figure out how much money should be spent on each of the agencies within their jurisdiction. So as a matter of fact, and as I mentioned a few minutes ago, the NIH is under the auspices of one appropriations subcommittee, NSF yet another subcommittee, and DOE a third appropriations subcommittee. So in fact, they're not competing in a one-to-one way for money. So it is in fact entirely possible and indeed desirable that the budgets for all of these agencies go up, and indeed they can. Because again, the way the money is allocated, it's allocated separately to each appropriations subcommittee in the House and Senate.
We've got another question. Can we get brochures or publications that talk about FAFSA's role nationally that we could leave behind with members of Congress or their aides take a look at, especially if we visit with them outside of dates when they're home for recess. That's one thing that we actually already make available online. While we do not do a lot of brochures, because most congressional offices are looking for much shorter information, we do have our FAFSA state and district fact sheets, which we highlighted earlier in the presentation. Those are simple things that you can download a PDF and print from your computer or your local Kinko's. You can also share electronic links with your members of Congress before or after a visit. So we really recommend you use the state and district fact sheets. As Ben noted too, our federal funding recommendations, we have a longer version of the report that's about 15 pages, and then we have actually a brochure version also available on our website, easy to print off, that you can bring with you to members of Congress or to their aides when you visit them. So these materials are freely available on the FAFSA website. You do not have to be a member of a FAFSA society to access them. We don't have a paywall or anything.
All right. One of you asks, when is the best time to write to my representative and senator? Should I wait until there is a vote? I would say the short answer is no. We encourage you to reach out to your members of Congress at any time, as soon as possible, I would say. It is true that when there are key votes coming up, for example, when votes are scheduled on appropriations bills, it's often very important to make your voice heard right around that time. But again, this goes back to the notion that we really see advocacy as having both a shorter term and a longer term component. In the short term, if something is immediately happening in Congress, you should reach out and make your voice heard. But of course, we encourage you to reach out to your members of Congress at any time, again, to try to develop relationships, to make them understand who you are, what it is that you're doing, why your science is important. And again, in a way, this also reinforces the fact that science requires a long-term investment. It's not something that you just vote on and then it goes away. It's an ongoing process, and that's something you can highlight if you get to know your members of Congress and really show them that this activity is ongoing in their districts and their home states.
Earlier, we also talked about letters to the editor and reaching out to your local paper, so I'm glad to see a question coming in. How big, professional, and good should the letter or op-ed be when sending it to Congress? Does FAFSA have any helpful guidelines? As a matter of fact, we do. Our guidelines are actually on our website under the Reach Out to the Public section. What we do recommend, first and foremost, is check the submission guidelines for your local newspapers, and also think about small regional papers or going to papers that have a significant online presence but may no longer be doing a print version every day. A lot of the online papers are looking for content, particularly from local citizens. So take a look and see what the submission policies are. We do suggest making it short, sweet, and professional, and invoke the, these federal dollars message have a huge impact on our local communities. So it doesn't have to be, the greatest thing ever written, but we do recommend keeping it very matter of fact, put in data about the impact of the research dollars on your state and how it impacts you personally, but keep it respectful, and you have a much better chance of actually getting it published. And if it does get published, by all means, send a copy, either electronically or in a hard copy format, to your member of Congress, both in their Washington office and in their local office. Most of them still get their daily press clippings and they have already seen it, but if not, you should certainly brag about the effort and put it to their attention.
One of you asks, what if I am meeting with my senator and she asks me questions that I cannot answer? Another great question. So this is something that in the moment can seem sort of awkward, but it need not be. I think this is a question we get all the time. If you're asked something and you don't know the answer, it's perfectly fine to simply say, I don't know. I think this is where we try to emphasize the importance of follow-up in your meeting. So you can say, I don't know, but I would follow that up immediately by saying, I will get back to you. So if, for example, they ask you something very specific about an agency budget or about some specific program, say, I'm not sure, but I will get back to you. And then please do follow up. And if there's information that you need, about specific agencies, about specific budgets, about policy matters, please don't hesitate to get in touch with us. We curate a treasure trove of information. We'd be happy to provide that information to you that then you can pass on to your elected officials.
Okay. Here's a question that actually refers to the budget increase that happened in 2017, but I want to answer it because I think this is a really important point. I was happy and surprised to see that NIH got a $2 billion increase in the 2017 budget. Why do you think this happened? Was the timing of the March for Science pertinent to the decision, and what can we do to leverage that momentum to continue to support NIH and other science agencies in 2018? That $2 billion increase was not an accident. That was actually a result of a lot of advocacy done by what I assume are people who are participating in this webinar and others across the country. It was over a year in the making. It required a number of congressional hearings with Dr. Collins and the NIH staff. FAFSA held a Capitol Hill Day and brought over 50 researchers to Washington, D.C. I also do believe that the March for Science happening a couple weeks before that budget passed was an important reminder to members of Congress who saw the marches across the country that they still had a job to do, that they had not yet passed a budget. And in fact, last summer, the Appropriations Committees had actually recommended a $2 billion increase. They just never acted on it. So again, this is part of the reason why we wanted to do this webinar today, is to show that we can change things around in Washington and we can wind up with good outcomes if people speak up.
One of you asks about reaching out to them. Does email work? Also, do we have to use Twitter when I don't use it? I would say the answer is that no, you're obviously not obligated to use Twitter. Twitter happens to be one popular platform at the moment, and there are at least some members of Congress who are quite active on Twitter. But we absolutely encourage you to email your members of Congress, email their offices, or simply make a phone call. Again, I think the most important thing is for you to reach out in the way that with which you're most comfortable, and any of these methods can be effective, particularly if you're trying to schedule a meeting. Both either an email or a telephone call can be highly effective.
Here's a good question in terms of kind of the overall context of the budget in itself. How can we put these budget increases in the context of the entire federal budget and what it means for the average taxpayer? Also, what are the main justifications for the requested increases? So on that first part of the question, kind of the broader context, what this money means to the entire federal budget. Compared to the entire federal budget, the funding for all the research agencies adds up to approximately 3% a year. So when we're asking for money for NIH and NSF and the Department of Energy, it represents a very, very tiny portion and fraction of the overall federal budget. So when we talk about cuts to a tiny portion of the budget, they do tend to have sort of a disproportionate impact, especially when you think about the fact that most of these federal research dollars leave Washington, D.C. and wind up in states and districts across the country. So don't ever be afraid to help put this in context and say what we're talking about here is about 3% of the total budget. We are not spending a lot of money, all things considered, on research, considering how many issues that we still have in this country with diseases and things we don't understand about certain conditions. The justification for the increase is laid out in our federal funding report, but primarily has to do with the fact that we know that sustained predictable funding for research across the board does have a huge return on investment, not only in improved health outcomes for individuals, a better understanding of diseases, commercialization of products, jobs in the biotechnology industry. All of this is laid out in our funding report. So if you are asked by an aide or a member of Congress, well, how can you ask for this money knowing that we have a growing federal deficit? Pivot back to the point that, again, we're still only spending about 3% of the total federal funds on this very important work. And with more research funding, we can provide more jobs in this country, and we can really help improve outcomes and reduce the rates of deaths from cancer and Alzheimer's and other diseases.
So one question that came in is, does FAFSA have any idea why the president is proposing such deep cuts in research funding? This is a great question. I think it's hard to guess specifically why, but I'll venture to say that one thing to keep in mind is that it's not necessarily the case that this is meant as a targeting of research. That the intention here is to really cut research funding, or specifically to cut research funding in biomedical science. There is simply a political group, including some members of the president's administration, who would like to see a reduction in discretionary spending in general. And at the same time, the president, when he was a candidate for office, made a lot of promises about increasing defense spending. So in many ways, the sort of overall shape of this budget should be, this story should be kept in mind if you think about sort of the overall shape of this budget proposal, that they were looking to greatly increase spending on defense programs. In order to do that, they wanted to offset them, so to speak, with cuts to non-defense programs. And so it really, I think, became an exercise in sort of balancing that ledger, that they had a target for defense they wanted to hit, and which meant that they began cutting elsewhere. I should also note, and this is, I think, a very important point to keep in mind, particularly in these polarized political times, is that biomedical and biological research have actually enjoyed very strong bipartisan support for a very long time. And indeed, some of the loudest voices on Capitol Hill who are decrying this budget and saying that it is not a good investment of our dollars are actually prominent Republicans, particularly Republicans on the appropriations committees that oversee the NIH and the other scientific agencies. So in a sense, many of our strongest allies are in fact other Republicans who understand the value of biomedical research. And so we really encourage all of you to reach out, again, to your senators and your representatives of both parties. We wholeheartedly believe that there still is bipartisan support for biomedical research, and we want to continue to make this advocacy push on a bipartisan fashion, because after all, biological and biomedical research benefits all people regardless of your political affiliation.
We are running up against the time, but we still have time for a few last-minute questions, so why don't we get to those. This is a good one on tactical issues. How do we reach out when making a phone call? Most likely, I will wind up leaving a voicemail message or being told by some aide that I'll pass the message along to my boss. We have some tips on our website as well, but when making a phone call, we suggest that you write down what you want to say before you do it, and really limit it to 3 points. First and foremost, make sure that you identify yourself as a constituent when you call. You may have to be asked to provide your street address to prove this information. Second, get to the point immediately and say, I'm calling because I have concerns about the proposed budget for NIH. If you can personalize your message and talk about why an issue is important to you, either professionally or personally or both, that's a good way to get the message across. And you can also say in the end, I would like to get a response from my member of Congress. Would it be possible to receive something in writing or a return phone call? And you never know. They may say, of course, or we could have a staff person call you back. So be sure to leave a phone number where you can easily be reached in case a staff person wants to get back in touch with you. And one last tip, you can also say when you leave the message, I'm a biomedical researcher or I'm a scientist. I would love to be a resource for you or your staff. Here's how you can reach me. So don't go on for too long, but if you can narrow your points down to 3 bullets, I think that's a good way to get your message across.
Okay, here's one. Is it better to contact my rep in my home district or in the institution that I work for? That is a really great question, another one we get very often. I would say that I would say try both, honestly. Mm-hmm. If you go to our website and use our online tool to find your members of Congress, if, for example, if your research institution is a different zip code, use that zip code as well as your home zip code, or the address of both your office and your home. I think it's important to reach as obviously as many members of Congress as possible, and as a constituent, I think it's important both to reach out to those members of Congress who represent where your institution is. They're obviously interested in the work going on in their district, but obviously as politicians, they're interested in where you vote as well. So I would say try reaching out to both offices, because you obviously have, as a constituent, you have interests in both of those places.
All right, we'll take one last question and wrap things up. This one is, are there talking points that we can use to ask our supportive congressmen to share with their less supportive colleagues? After all, they really see each other every day and we don't. We do have talking points on the FAFSA website that can be repurposed for this. They don't specifically address this now, certainly something we can think about doing and putting up on the Advocacy Tools website. One thing I will say is that if you do have a member of Congress who's interested in talking to a less supportive colleague, highlight the local impact of these research dollars. And again, we bring up the FAFSA state and district fact sheets. NIH funding goes to every state in the country and nearly every congressional district. So if your member of Congress or their staff aide says, I'm interested in talking to my colleague from the delegation and I don't know what to say, show them the state and district fact sheets, and that's one way to have a great conversation very quickly. So we've reached the end of our time now. Wanted to thank everyone for participating in this webinar and for putting in such wonderful questions and being so engaged. Here's some information about how you can reach us after the webinar if you have additional questions. We do keep a close eye on our Twitter feed as well. Consider following us. And then just a quick reminder, we will provide an archived copy of this recording on our website. If you signed up and registered for this webinar, you will automatically receive a link to that recording. So keep an eye out for that in about 4 or 5 days. Thanks, everyone, and we hope to see you on Twitter and on our website.
Great. Thank you very much. Have a good day.